Exceptionally delighted and thrilled to have Dr. Jerome, Surgeon General of the United States of America. Dr. Adams, thank you so much for being here. We greatly appreciate your service to our country and appreciate you being here with us again. And you are a guest now, but as I told you, we expect you to come back to campus. We're going to make your family. So
I would love that. I would love the opportunity
very much. I know that Dr. Stephen Goggins is here. Dr. Goggins, raise your hand. Thank you. Dr. Goggins is the director of the East Central District of the Department of Health. And Dr. Stephen, let me tell you, you've got great leadership in this state today. Dr. Goggins has worked with us extensively. We appreciate your input and everything that you have done along with us as well. We've got a number of other representatives here. I want to just very briefly point out, as I call your name, if you just please raise your hand. I'll probably forget someone, so forgive me if I do. But Representative Patty Bentley from Butler, Georgia is here. Thank you very much. Representative Casey Carpenter from Dallas. Where are you? He's out of uniform.
Short guy in the back, out of uniform.
After sit down in Augusta, we appreciate you being here. Representative Mike Jackson from Sandersville. Thank you, sir. Appreciate you being here. And we are truly blessed that Richmond Columbia Campus have an outstanding delegation. I want to recognize our folks that are here. Representative Sheila Nelson, Representative Barry Fleming, Representative Brian Prince. There we go, thanks sir. Representative Wayne Howard, Representative Mark Newton, and we have Senator Harold Jones and Senator Jesse Stone. Let's give them a round of applause. I also want to recognize Nancy Bobbitt, representing to the left with Bobbitt. Nancy, you've always, thank you so much. We appreciate it. And just on time, Grant, I talk about a threat to Augusta and free with Augusta. I also want to very briefly recognize my senior staff here as part of this event. First, Ms. Katrina Kiefer. Katrina is Executive Vice President of Clinical Affairs and CEO of the Health System. Katrina's over here. She and her staff have done yeoman's work in terms of making Augusta University Health System what it is, putting us in a position to help in the state. Dr. Philip Poole is AUHS Chief Medical Officer, and I give him a hard time about he is truly Dr. COVID. I mean that in all sincerity and all warmth, because he has been the outward face during this pandemic and done a marvelous job helping us with our public service point of view. Dr. David Hess, Executive Vice President of Medical Affairs at the Medical College. David, thank you very much. Appreciate y'all being there. There's so many more going on, but I'm going to stop at that point. Because you all came here not to hear me, you came here to hear the governor. But let me just very briefly mention our university while we're here. Augusta University is the home of the Medical College of Georgia. It's the 8th largest medical school in the country. It is the 13th oldest, and it is the only public medical school in this state. We're very proud of that. We're also home to the state's only dental college. We are the state's only designated health sciences medical university. And we're the home of the Augusta University Health System. In addition to an adult hospital, we have the Children's Hospital of Georgia and the Cancer Center that we are fortunate to have and we're standing in front of today. All of that together makes us the state's only public academic medical center and brings together the expertise of the folks that you see out here today, bring that expertise to bear. We are uniquely positioned because of that to train not only the next generation of healthcare providers, but also provide state-of-the-art care for the citizens of the CSRA, state of Georgia, our region, and beyond. You know, it's hard to believe, but this is the 4th anniversary of the first patient tested positive in the state of Georgia. That was on March the 2nd, now July 2nd. It's only been 4 months, and it seems like 4 years. We've been a major player in the fight against COVID-19. We were the first in the state to develop an in-house test of COVID-19 in addition to the CDC and the Department of Health. It provided results in hours instead of days. We set up the first drive-through testing facility here in Richmond County and on campus and also in Columbia County, first in the region, first and only institution to provide a telehealth virtual COVID-19 screening app, providing 24/7 coverage and telehealth provision at no cost for the great citizens of Georgia. And we're now offering in-house antibody testing for this particular virus. This experience has suited us very well for the fight against COVID-19. Since we began this fight, we have taken over 29,000 hotline calls. We've done more than 20,000 telehealth virtual visits from across the state. We've done more than 21,000 drive-through testing at our facility. More than 23,500 in-house COVID-19 tests, PCR, and now in the process of ramping up, we've done over 2,600 COVID-19 antibody tests. This is what you expect in the states on the public access medical center, and we're very, very proud to continue this role. In April, the governor asked us if we would work in collaboration in conjunction with the Department of Health and with the National Guard to take the experience that we have here and take it statewide. The governor, we appreciate very much the confidence that you've expressed in us. And we promise to stand with you thick or thin in the days and months to come. So where are we now? We know the number of COVID-19 positive cases in Georgia is increasing, and it's increasing in large part because of the incredible ramp-up we've had in testing. And again, thanks to the governor and his staff, and Dr. Toomey and her staff, for making testing available to all citizens of Georgia. Our hospital is full, and we know that, but that's also due in part because we are now doing the elective procedures that we've had to put on hold for so long. So yeah, we've got a lot of people in the hospital, but they're there for elective procedures. They're there because they have put off getting the necessary treatments that they had, because they were afraid to come to the hospital. Folks, we need to send the message out that hospital is the safest place you can be right now. And we're starting to see that with an influx of patients coming in. We need to tell our patients it's safe, and this is the place to come. The past 4 months has given us an immense experience preparing for and dealing with a pandemic the likes of which no one could have ever dreamed of. Bottom line, we are battle-worn and field-tested, and we're prepared for any foreseeable increase that may come our way in the future. Your state's public academic medical center is ready to serve today, tomorrow, and for the weeks and months to come. On the university side of the house, we're working closely with the University System of Georgia to have in-person classroom experience for our students starting on August the 10th. And I want to thank Chancellor Wrigley and Region Chairman such as Shalindra for their leadership in helping us do that. We're phasing in, bringing our staff back. We're working with our faculty to have social distance classroom experience. It's not going to look like it did last fall, we know that, but we're going to provide that, and we're remaining flexible and expecting that things not only may change, they're going to, and we know that. We will ensure a safe environment while striving for the full college experience, but we know that that depends on each and every one of us, our students, our faculty, and our staff, and the citizens of this community, to take personal responsibility for our own actions. You've heard this before. Wash your hands, exercise social distancing, and wear a mask in public spaces. We feel so strongly about that we're going to be providing 2 masks like the one I'm wearing here for every student, faculty, and staff member here at Augusta University when they come back on August the 10th. And we're going to strongly recommend and suggest that they do that because it's the right thing to do. And wearing a mask is really what we're here for today. And again, I want to thank Governor Kemp so much for his emphasis on this and for being here to promote this. Governor Brian Kemp is a friend of small business, he's a friend of higher education, he's a friend of Augusta University, and I'm proud to call him a personal friend. He and his team have gone above and beyond to support Augusta University and our health system since COVID-19 reared its ugly head. From increasing testing capacity in our lab, promoting COVID-19 telehealth virtual screening out statewide during the early onset of the pandemic, Governor Kemp paved the way to help us fight this virus. After we received the much-needed support of $1 million from the Augusta National Golf Club to increase testing here in Augusta, we're so fortunate and so grateful to them. Governor Kemp helped us expand that to receive additional funding from the Peach Bowl and from other foundations throughout the state to help us with this effort, including SK Innovation. To throughout the midst of the pandemic, when Georgians were feeling uncertain about how we would move forward and healthcare providers were feeling uncertain about the risks they were walking into every day, Governor Kemp's participation in the parking lot fare service here in Augusta was impactful to our healthcare providers and the entire community. Governor Kemp also provided personalized congratulations to Augusta University's virtual commencement exercises that I know meant a great deal to our graduates and their families who were not able to visit and experience the traditional commencement ceremony. These are just a few examples of how Governor Kemp and his team have led the state, cared for its people, supported our community, invested in our university, and helped sustain and advance our health system. He continues to be a leader who is thoughtful, deliberate, hardworking, and honorable, and I want to thank you, Governor Kemp, for all that you continue to do to help move our great state forward. I also want to extend my sincere gratitude to First Lady Marty Kemp and your daughters, and indeed your entire team for the sacrifices you continue to make to lead our state out of this pandemic. We stand with you in the fight against COVID-19. Governor, it's always an honor to host you and your team on campus, and we look forward to your remarks. Ladies and gentlemen, would you please join me in welcoming the 83rd Governor of the great state of Georgia, the Honorable Brian Kemp.
Really appreciate the strong show of support from the community and the network here at Augusta University Medical Center. Dr. Keel, thank you for really all the great work that your team has done on the ground here early on in our fight against COVID. It's great to be back here at the Cancer Center. I can't tell you how excited I am today to have Dr. Adams, our U.S. Surgeon General, traveling with us. Just a great guy, number one. But number two, really helping sell our citizens a great message going into the July 4th weekend. And we just appreciate the partnership that we've had with the Trump administration, the Vice President's leadership, who Dr. Adams used to work with back in Indiana, as well as Governor Holcomb, two people I know very well. He's very accomplished, but he understands, being in that role, working for a former governor, of what our public health people and what you all are dealing with on the ground every day. And I think that's immeasurable. So, Surgeon General, we're proud to have you in Georgia. I also have my sidekick, Dr. Timmy, with me again today, who's doing a great job as our Georgia Department of Public Health Commissioner. I want to again thank all the folks from Augusta University and the medical team that's here today, and I appreciate Brooke introducing everybody. So I didn't have to do that, but thank you all for hosting us today. I know this is a little disruptive doing things like this, especially on the campus, but I think it sends a strong message about how serious we are about this fight that we're in, and our renewed commitment to the fight, especially going into the July 4th weekend. I want to thank all the members of the General Assembly that are here, and certainly the local delegation. They have been great friends of mine that I've served with and worked with, and it's really kind of hard to believe as tough the economic times as we've been in. We just had probably one of the best legislative sessions that I've ever been a part of, including the budget, which is bittersweet because it looks a lot different than what we thought it looked like when I proposed it back in December, early January, and when the House passed their budget, and then COVID hit, and it changed the dynamic when it went to the Senate. But you never saw a lot of finger pointing. All you saw was people working together, Republicans and Democrats, on things that matter to keep our focus in the state where it should be, on health care, on education, on public safety, and economic development in all parts of our state to bring our economy back. And I want to thank you all for your support. But I also want to thank you for your support on the public health state of emergency, which has been extended once again. The ability for us to maneuver very quickly during the pandemic because of the support that the General Assembly gave to a governor for what I believe is the first time in the history of our state with that public health state of emergency has helped us do things like we have done in partnership here in Augusta with the university and the medical school. It has helped us be able to allow exemptions for healthcare workers, doctors, nurses, and other people that may have been coming from other states. It's helped us be able to protect our healthcare workforce is you have to work long hours in an environment that, quite honestly, 3-4 months ago you weren't familiar with, and many, many other things from a financial resources standpoint. So thank you all for that support. I know it was unprecedented, and I have made sure that we made decisions that were in the best interest of our state and our people. As you all know, these are challenging times for our state and our country. And there's a lot of people, as Dr. Keel did, that we need to thank who have been on the front lines of the fight against COVID-19. And a lot of them are right here in front of us today, and many are behind these walls. Our doctors, our nurses, the support staff, people that you normally wouldn't see when you walk the halls of the hospital, who have all been part of the fight against COVID. Our first responders, law enforcement, certainly our National Guard, who I believe the Georgia National Guard has done more than any other National Guard across the country fighting COVID-19. General Carden and his team have done remarkable work when it comes to long-term care facilities, testing, delivering food and supplies to those that need it, and many, many others. I also want to thank our hospitals, the workers in the hospitals, as well as our local businesses that have stood up and helped us in the fight, and helped financially those that were in the fight, as well as our community leaders. And because of all of that, we are making progress in our fight against COVID-19. Our hospitals are prepared. Our surge capacity continues to remain solid around the state. And there are good things to talk about right now. Our mortality rate continues to decline, and we want to keep it that way by focusing on our long-term care facilities, the medically fragile, and protecting those that are getting hit hardest from this disease. But that being said, we definitely have issues that are out there with the spread that we're seeing not only in Georgia but across the country. We must remain vigilant because of the uptick, and it is a clear reminder that we are not out of the woods yet. We have to continue to be vigilant in the fight to protect the lives as well as the livelihoods of all Georgians. And as I've been telling people for the last 24 hours, and I'll continue to do the rest of the day, we cannot become complacent or weary. And I know on the weary part, I'm speaking to a lot of people in front of me that have worked very long hours, 7 days a week for a long time in this fight. And we thank you, and we want you to know that we are not getting weary in our level of support to help you all that are on the front lines of this battle. And we don't need our citizens getting weary either. We have to continue to fight on. It is a new day with a new challenge, a new time to keep chopping. And that is a good reason to do this heading into the July 4th weekend as we celebrate America's independence, as we celebrate the great freedoms that we have in this state, in this country, and we honor those that have fought hard to defend those freedoms. I'm fully aware that we have all had to make sacrifices during this pandemic. And that has been the responsibility, quite honestly, of all Americans and all Georgians. And we are continuing to travel the state to encourage Georgians to do the right thing. Practice social distancing. Wash your hands. Wear your mask when you're going out in public if you can't socially distance yourself. By following the guidance provided by our public health officials, you can protect yourselves, you can protect your loved ones, your community, as well as your state. Your actions can help end this pandemic and continue our economic recovery, which is so vital in our response to the many, many things that we are doing. We are all in this fight together, and I'm urging everyone to do their part. With that being said, I hope you all have a safe and a happy July 4th weekend. And it's now my honor to turn it over to our U.S. Surgeon General, Dr. Jerome. Dr. Adams.
Well, good morning, everyone.
Good morning.
Good morning, Augusta.
Good morning.
All right. Well, it really is great to be here. And it may seem odd that I say that, but there are a lot of false choices being presented out there. People want to make you choose between reopening the economy and reopening access to health care and treating COVID. People want to make you choose between hopelessness and optimism. And I think those are false choices. I think we can acknowledge the urgency and the severity of the moment, but we can also acknowledge the progress that has been made and acknowledge the opportunity that we have to actually dig ourselves out of the hole that COVID has put us in. And so I hope that you all both leave here today feeling the seriousness of the moment going into a holiday weekend, but also leave here feeling a lot more optimistic about the fact that we have the tools to be able to prevent COVID and to treat COVID. And, you know, it's really powerful to be standing here in this moment. Many of you all don't know, I spent the last 10 years at an academic medical center, level 1 trauma hospital as a professor of anesthesia before I became Surgeon General. Do we have any residents or medical students out there? It's that time of year. They're all working. They all just started. So this is one of the most exciting times of the year to be on campus because you've got the new students out there learning how to take care of other people. And to be here in front of the campus center, some of you may know this. My wife just finished treatment for metastatic melanoma. And if a situation like COVID had occurred a year earlier, my wife perhaps would not have gotten picked up early enough. She wouldn't have gotten her surgery early enough. She wouldn't have started her immunotherapy early enough. And I might be standing here today in front of you as a widower instead of as a husband who have a wife at home. So it's critically important that we all take measures to stop the spread of COVID and that we also balance that with a safe, a smart, and intelligent reopening so that we can make sure everyone can access the healthcare services they need. And I want to thank Governor Kemp for the work that you've done to help Georgia start through a safe reopening. And I want to thank you for inviting me to come out and talk about the steps that we can take to make that happen. I want to thank our legislators for being here today. This pandemic has hit us hard, particularly people of color, and particularly those who are older. And we must make sure we are paying attention to and engaging those communities and protecting those communities. The reasons why they're hard hit are both rooted in medical and in social conditions that conspire to reduce our resilience, our opportunity, and our health. In short, COVID-19 is exploiting many of the pre-existing health disparities that we know were all around us before we ever heard of this thing called SARS-CoV-2. I also want to make the point that while a lot of the focus has been on the older populations, and we know are dying at disproportionately high rates, most of the new cases are in people under the age of 40. The governor shared with me that on his tour yesterday, he was in a community where they said 53% of the new cases were in people aged 18 to 35. 53%. So one of the key messages we need to get out is that young people now are the ones that are disproportionately spreading this disease. Young people are being hospitalized at increasing rates. Young people, unfortunately, even though they are at lower risk, still can take this disease home to their loved ones, to their parents, to their grandparents, and put them in a situation where they're in the hospital or worse. And so young people are who we need to reach out to and to engage to help overcome this crisis. But the good news, and again, there's good news, is that we know what works to keep people healthy and communities safe. The power to slow the spread of coronavirus literally lies within all of us. It's not in Washington, D.C. It's not in the State House. It's literally within all of us if we take the basic public health measures that you've heard about over and over and over again. Number one, good hand hygiene. I'm going to demonstrate it right here. Make sure you get both sides of the hand in between the fingers if you use hand sanitizer. If you wash your hands, make sure you wash them with soap and water for 20 seconds. Number two, stay home if you are in the vulnerable category. We know people with high blood pressure, people with diabetes, people with obesity are particularly high risk for COVID-19. So if you're in that high risk category, stay at home. If you're sick, stay at home. even if you just got a little tickle in your throat, now's not the time to be potentially exposing other people to the disease. If you do go out, maintain 6 feet of distance at least between you and the nearest person when you can. And when that's not possible, please wear a face covering, a mask to protect others around you. This is the most effective tool we have, and the governor talked about 4th of July. 4th of July is all about freedom. And I've heard people say that this is an imposition on my freedom. This is an impediment to my right to choose. Again, I reject that argument. The more of us who wear these, the more we will be able to open safely and stay open, and the more choices, the more freedom, the more opportunities we will have. This mask is an instrument of freedom if we all use it to be able to slow the spread of COVID-19. So I want to close with a couple of points. I want to share the governor's thanks and appreciation to the healthcare workers, to the public health workers, to the support staff, to all the people who have been coming in and putting in the work, even in the midst of a deadly pandemic, to protect your communities. You don't hear it enough, but from the Surgeon General of the United States, thank you. Thank you so very much. And please be cognizant not only of your own physical health, but also of your mental health. Make sure you're taking a little bit of time for yourself and your family, because you can't take care of other people if you don't first take care of yourself. I urge healthcare providers to begin planning for systems that will ensure everyone gets their flu shots this fall. In Georgia and across the country, less than 50% of adults actually get their flu shot. You know what that means? That means every time you turn on the TV and you hear people talking about when are we going to get a COVID vaccine, that doesn't matter if people don't actually get the vaccine after it's been proven to be safe and effective. Vaccine hesitancy is a real concern in our country. And before COVID, we were talking about the measles outbreaks that we were having all across this country. We need all of you to help people understand vaccines are safe and effective. And we need you to help engage communities where that hesitancy exists, so that when we do get a safe and effective COVID vaccine, we actually can get it to the people who need it the most. And we don't want a double whammy this fall. We don't want a bad flu season on top of a bad COVID season overwhelming your hospital systems. So the most important thing, one of the most important things you can do going into the fall, is to make sure you and everyone around you gets their flu shot, and to make sure you're talking about the importance, the safety, the efficacy of a flu shot. I want to finish with my Surgeon General's prescription to everyone. 3 key points. Number 1, know your risk. Know if you are at high risk for complications from COVID. Again, high blood pressure, diabetes, and obesity are the 3 biggest risk factors. So go to coronavirus.gov or your State Department of Health website for more about whether or not you are at risk. Know your risk, number 1. Number 2, know your circumstances. Are you going to be outside or inside? Are you going to be in a place where you can social distance or not? Are you in a community where spread is going up or coming down? Number 3, take measures to protect yourself. If number 1 and 2 tell you you're at high risk, then the best thing to do is to stay home. But if you do decide to go out, then again, wear a mask, practice good hand hygiene, practice good social distancing, do the things that we know will prevent the spread of this disease. Because things can go really bad, really fast in COVID time, but the good news is things can get better really quickly in COVID time. It's only been 4 months that we've been dealing with this disease. It's only been a little over a month that we stopped talking about Italy and people dying in hallways. That we stopped talking about the tragedy that's occurred in China and in Europe. We can get there. We can be there if we take these basic public health measures. And any of you all like the Masters being here?
Yeah.
It's supposed to happen in November, right? If you all want the Masters, this is the way to get us to the Masters. Young people out there, the governor, I got to give him credit for this line. It's the best line I've heard in a long time. You want college football this year? This is the way you get it. It's just a shame, and I've given a lot of virtual graduation speeches. So many people have missed graduations, missed proms. If you want prom, if you want spring break next year, this is the way that you get it. So I'm going to ask all of you all to join in with me, because I'm going to put this on my social media channel. We will stop COVID. And I want all of you to say this with me together. 1, 2, 3. We will stop COVID. We absolutely have the power in our hands with these masks to do it. I'm confident, and I hope you leave here optimistic about our chances to do that, and that you share that message with everyone. Thank you very much.
Thanks so much, Dr. Adams, for being here, but also what you don't know is he gave me his phone number early on. And I actually called him, and he answers on a weekend. And it's given me some great advice, and has helped allow us to expand our testing when we did. I really have to sincerely thank you, Dr. for the extraordinary leadership, particularly at this time when we see the increases here in Georgia. This is, we have worked so hard to get here today, and now to see, and all of you here in the news, public health, all of our statewide, all of our healthcare workers and nurses statewide have been working tirelessly, and to see this not being taken as seriously as it needs to be, often by young people, is very discouraging. And the simple messages of wear a mask, social distance, wash your hands, are just so important at this time. In a discussion I had with our health directors, they said to me, Kathleen, what you're trying to do is change the social norms around wearing masks. And because I've had friends in many, go out into many buildings, go out into many places of business, and they're told, you're wearing that, you're a sissy, it's stupid, why are you wearing a mask? And this is all over Georgia. I think what we need to do is change the social norm that it's cool to wear a mask, and it's not cool to not be in a mask. And so that we actually turn it around. We were able to change social norms around smoking in 30 years. We don't have 30 years. We have a few days to do this and do this effectively so we can keep our numbers down and have those outcomes that the governor and Dr. Adams talked about. One final reminder is if you get a call from public health, pick up the phone. We have, in addition to our 160-some test sites around Georgia, which is augmented by much of the testing going on here at AU and other universities and private facilities around the state. We have over 1,300 contact tracers deployed statewide to be able to follow up on identified people who have infection and have potentially exposed others, and by contacting them, can find them quickly before they become cases, before they even know they're infected, and have them in quarantine and stop the spread that way. We can just break this chain of transmission very, very quickly if we can work together with everyone answering the phone and following up with us. And sadly, statewide, we are not getting the kind of cooperation we need, both from individuals who have tested positive, as well as those who have been identified as contacts. I mean, this is so critical, that this is part of that personal responsibility of wearing a mask. It's also help us help you keep Georgia safe. So please, when you get that call that says DPH COVID team, please pick up the phone and do that. With those parameters of social distancing, masking, washing your hands, but also working with us if you do test positive to help us with contact tracing and helping us identify where that spread may occur to stop it in its tracks. We can end this virus. It's going to require all of us working together, and I really appreciate everyone here today to help us in that effort. Thanks so much.
Questions here, if y'all got them for me, Dr. Adams, Dr. Timmy, Dr. Neal. No, we're good to go. Oh, there's no question about it. But like I said at several stops yesterday and this morning, Dr. Adams, Dr. Toomey, myself, our folks that are on the front lines of the public health network across the state, the people that are working in the hospitals. Quite honestly, we don't have time for politics. We're working on protecting the lives and the livelihoods of people. The good thing about it is all the people that are politicizing this issue, we all agree on the same thing. It's a good idea to wear a mask. I don't think we need a mandate for people to do the right thing. I have great trust in our citizens to heed the call. They've done it before. They did it to help us flatten the curve and stop the spread before, and we can do it again. There's no doubt in my mind, and as Dr. Adams reminded everybody, that can happen very quickly. And that's why we're just asking people, let's hunker down for a couple of weeks here. Let's get these numbers going in the right direction. Let's don't have a bad COVID season this fall. Let's don't have a bad flu season this fall. Let's have a good football season this fall.
There you go.
I'm not on that one because the governor told me just this wonderful story earlier about a coffee shop in Georgia that actually is giving people discounts if they wear a face covering and a mask when they come in to get their coffee. The fact is, most people actually agree with wearing a mask. And if you look at surveys, most people are doing it when they go out in public. But if you turned on the news, you'd think nobody was wearing a face covering. So my ask of you all, as advocates in the community and also to the media, is please share those positive stories. Share the upside of why people are wearing face coverings. Ask people when you see them wearing them, why are you wearing them? Instead of asking people, why aren't you wearing them? Let's make this a positive thing. Let's normalize the positive behavior instead of trying to shame the negative behavior. We know in public health, Dr. Toomey has been in this game a long time. Going back to HIV, STD testing, you don't shame people into behaving in a way that you want. It just doesn't work in public health. You have to show them the upside, the benefits. You've got to normalize that positive behavior. And there is plenty of positive behavior out there for us to acknowledge and to normalize. If we just focus on that, I think we'll have more people doing the right thing.
Now, Dr. Evans, to follow up to that, early on in the pandemic, we were urging very publicly people to stop buying masks and stop wearing masks. Now, can you explain what has changed since? I think that's been confusing.
Well, that's a great question. So, COVID-19 is a very humbling disease. 4 months, and it seems like every day we learn something new about this disease. We've always said that if you had symptoms, if you had a fever, a cough, or a cold, and you had to go out in public, that you should wear a face covering to prevent you spreading your disease to someone else. We've always said that about the flu, about past coronaviruses, and about COVID-19. If you have symptoms, you should stay home. If you have to go out, you should wear a face covering. What's changed is we learned COVID-19, unlike all the other coronaviruses we've had experience with, has a high degree of asymptomatic spread, meaning over 50% or more in cases are spread with people who don't have symptoms. You don't know if you're sick or if you're not. So when we realized that about COVID-19, we changed the recommendations to say that people should wear a face covering because you don't know if you're sick or not. So that's why it changed. That's how science works. We make the best recommendations we can based on the information we have available at the time. And then when the information changes, we change those recommendations. So I would ask that you help us spread, again, the insight behind why those recommendations changed, and to help people understand that we will continue to learn more about this virus and adjust our recommendations when we learn more about this virus. But right now, the best advice that we have based on what we know about asymptomatic spread is that everyone in public should be wearing a mask or a face covering to protect those around them.
Quick
Thank you.
question. I know you guys have mentioned, sports and being able to watch them. Are there any? I know you guys have mentioned sports. Is there any concern that you guys are carrying with that or is being problematic? I know most sports are contact.
I'm not sure I could hear you. The last part of that.
Is there any mandate that you maybe have a plan for, or just how that looks like moving forward? Because most sports are contact sports.
Yeah, I think it depends on kind of where we are. I mean, certainly Dr. Adams and Dr. Toomey can speak to this question. I'm going to continue to make decisions based on the science and the data that we're seeing, the advice that I'm getting from Dr. Toomey and other people on our team. And, we've talked to a lot of people, including Dr. Mark. Marquette, great representative, and many other people in a lot of different places around the state, as well as our partners at the university system. And I don't know what we know. I don't know that we know what that looks like now. As you can tell, as Dr. Adams was just saying, a lot changes in a month or in 4 months. And, we'll see what happens. But our best chance of being able to do that is if everybody will follow the guidance over the next couple of weeks, and let's flatten the curve and see where we are, and be moving in a different direction with the spread than we are right now.
Governor, more specifically, Governor McMaster today canceled football on the high school level. Any comment on that or anything?
Yeah, I mean, I just saw a little blip about that. I don't know. I haven't talked to Henry about that. I don't know his reasonings behind that. I mean, obviously, I'm not at that point yet. I want to continue to stay optimistic, and that's what I'm going to do. I think our people need that right now. This is a tough time. Dr. Adams talked about people. I mean, look, we have a rising senior in high school and a rising senior in the University of Georgia. We know a lot of our friends that we've watched play sports, and friends of our kids in school, they didn't get to go to graduation. I've done the virtual graduations as well. As Dr. Keel mentioned that, those things hurt. I mean, we heard from parents this spring when we were going through this about, kids not getting to play their senior baseball season, senior soccer season, senior golf and other sports, and that's tough. That's part of the ramifications of the virus that we have to think about as leaders, not just from a COVID perspective, but from an overall health, mental health, physical health, just your outlook helps you get through the tough world that we're living in.
I just will say really quickly, I want you to understand this disease spreads person to person. So the closer people are, the more likely it is to spread. That is why we're concerned about people not social distancing, and that's why we're concerned about contact sports, or sports where you have to be close together, or environments where you have to congregate close together. It's important to understand that, number one. But number two, if there is no disease circulating in the community, then you don't have a concern about that disease spreading person to person. So the most effective thing we can do is engage in these basic public health measures, which will slow down the prevalence of the disease in the community, and that's wearing a face covering, washing your hands frequently. Also important to note that sports, before COVID-19, we were worried about the opioid epidemic. We were worried about obesity as an epidemic. We were worried about depression and mental health and suicide as epidemics. Well, being in school, being in sports, lowers your risk of all three of those things. So we have to understand the importance of safely reopening. We can't just say it's either sports or it's COVID. We care about one or the other. We have to care about both. And there is a way to care about both, and that's by, again, learning how we live with COVID, how we lower the spread, how we lower the prevalence, so that we can more safely reopen many of these activities, which have benefits in a number of ways for our health that we are just now beginning to realize. I really am concerned that you're going to see many more negative health outcomes from the closures than we've acknowledged. So, again, thank you for that question, and we will continue to work to follow the data, but we need you all to work to lower the prevalence so that we can safely reopen.
My last question would be, I know, early May is interesting times, more so this is a day-to-day type of thing. What would you say to that, people who are at home listening, kind of how to manage day-to-day, people don't know where their next meal is going to come from, if they're going to be able to get a job anytime soon. So can you say anything about just the day-to-day basis?
Well, I would tell those people, number one, they have a governor that's working hard to put them back to work. We're going to keep doing that despite what this virus does. I've been saying for a long time now, we're fighting two battles. We're fighting the battle on the virus, but we're also fighting the battle for the livelihoods of our citizens. Look, as a small business guy, I've been there. I know I've had those weeks where I barely was able to pay the people that were working with me, many times borrowing money to do that. I've had times where I couldn't pay suppliers that I had, wondering that evening whether I was going to make it. But I had to get up the next morning to go back to work and hope that I could get a break. And that's exactly what we got to do right now. That's why we cannot get complacent. We cannot get weary. We have to fight on. And I will promise all Georgians I'm fighting literally 7 days a week, 24 hours a day. Dr. Toomey and her team is doing that. These folks at this medical facility are doing that. There's people all across our state and our country doing that. Because we know people being at home, not having a job, being able to provide for their family, buy medications, to wonder where their next meal is coming from, that is not a good situation. That is worse in many ways than the virus itself. So we have to strike that balance. And I can assure you that we are working on that every single day, fighting on multiple fronts. So they should have great hope and optimism. We live in the greatest state in the country. Dr. Adams is going to figure that out by the end of the day. I'm serious. You can get anything you want in Georgia. You can have great opportunities through education at many different levels. We got great doctors and hospitals. We've got great communities like these communities that support our whole state and put on great events like the Masters and many other things. There's so much opportunity. We have so much to be thankful for, even in these just crazy, unprecedented times that we are in. But I am very optimistic, and I would hope that all Georgians would be, no matter their state right now. If they're out there and they need help, they are struggling, you know, we have mental health hotlines and other things that people can call, talk to someone. We got the National Guard that's out there still delivering food, boxes representing Casey Carter. I don't know if he knows there he is. He's here today. He's from Dalton. He didn't ride with me on the plane from Dalton down here, but he was already here working on the food box program, helping get fresh Georgia-grown produce out to folks that need it. So there's a lot of resources that we have through this, especially the federal response, the CARES dollars that the President, the Vice President, the task force, and Senator Leffler, and many other people in Washington have worked on. Well, thank you guys for being here.
Got to have